we're talking about patience now. You might have come across the game 4 pictures and 1 word, right? But with these 4 pictures, there's one theme here. It's a little bit tricky, but I think you might be able to get it. And just looking at it, what do you guys think? Thinking of patience again, thinking of communication, what do you think the theme is between these 4 pictures? And if you can't find a theme, just tell me what you can see, and you could just unmute yourself.
I think maybe that there are so many different ways that you can communicate with different people, and that they can be
Okay,
interpreted in different settings as well.
okay, okay, good, good, good. Anybody else?
I was thinking like variety.
Variety, okay, okay, good. Anyone else?
Maybe like understanding.
Understanding, okay. All in the right kind of path, yeah. Anyone else? No, we'll take what we have, which was good. So with these 4 pictures, the theme kind of is really 4 different patient groups that you might actually have to adapt your communication. So when we talked about medical jargon originally, that is just even for the general population. But even with that understanding as medics, you're going to have to understand the different patient groups that you're dealing with. So for example, in the top left there, you've got the elderly, you've got children, you might have patients with learning disabilities, you might even have carers. You'll come across something called a collateral history, where you're actually going to have to speak to other people. For example, even when somebody faints, the person who fainted might not remember everything that happened, or if they had a seizure, you might have to speak to other people. And then the last group of people are people who, where there's a language barrier, English might not be their first language, yeah? So there's patient groups that you might have to be a bit more considerate about the type of communication that you're going to use. And I'm going to give you guys an example that actually happened to me on placement a few weeks ago. So I had, let's say it was an 80-year-old male, right? On a general geriatrics ward, so a ward for the elderly, and they are really, really confused, sitting in front of you, really confused. They usually have a hearing aid because they've got hearing loss, okay? And you're in front of them, COVID times, so I have a mask on, I have a visor, and I'm trying to speak to them. They don't really hear what I'm saying because they don't have the hearing aid, and they're also quite confused. But I've been sent to tell them that they need a chest x-ray because we think they have an infection. But they can't hear me and they're really confused. What would you guys do in that situation?
You could write down what you're trying to say and then show it to them.
Okay. Okay. Anything else?
Maybe like take it slow and kind of try to get a conversation with them just to like make them more comfortable maybe.
Yeah, yeah. It's good. Somebody else is going to say something. I didn't see you.
If there is any chance that the person knows sign language and you also know sign language, you could use that as a way to communicate.
Very good. Yeah. Okay, those are 3 quite good answers and quite effective ways. I think sign language, we didn't actually think of that in the moment, but what we did do is we started off with what George's idea was trying to take it slow, trying to speak to them. But when patients are really confused, it can be quite difficult. But what we ended up doing is what Luke said in the end, getting a piece of paper, writing down the questions. And what you'll see is that sometimes, especially with confusion, you score the patient on how confused they are. And when we actually wrote down the questions for the patient, we realized that they weren't as confused as we thought. They actually understood everything that was happening. But could you imagine if we thought someone was really confused, they had no idea where they were, and then we start making all these decisions for them, not realizing that they're very much aware of what's happening. So things like that, adapting your communication, something small like that is something that you will apply through medical school, right? So moving on,